Sickle cell anemia is an inherited disorder that affects the red blood cells. Because it is inherited, it means that it can be passed from parent to child. People with sickle cell anemia have a change or mutation in the hemoglobin gene. This faulty version of the gene causes the hemoglobin to form strands in the red blood cells, which makes them inflexible and gives them a crescent or a sickle shape. These unusually shaped red blood vessels can cause blockages in sections of the blood vessels. Red blood cells cannot pass through the blockages to reach the cells in tissues and organs, so the cells cannot get oxygen and glucose for respiration. When this happens, it causes pain called a sickle cell crisis. The symptoms of a crisis can be severe and last from a few minutes to several weeks.
Blockage of blood vessels can lead to headache, dizziness, seizures, and stroke, chronic pain and pain crisis, lung problems, including acute chest syndrome, organ damage, including the brain and the eyes.
So, how is sickle cell anemia inherited? Well, to have the disorder, you have to have 2 copies of the faulty allele, which is a recessive allele. People who have 1 copy of the recessive allele are carriers. The red blood cells of carriers have 50% abnormal hemoglobin and are slightly more fragile than normal. If these 2 sickle cell carrier parents have offspring, they can have children with the disorder, children who are also carriers, or children who are completely unaffected.
The implications of this is that when both partners are carriers of sickle cell trait, that is AS, then for every pregnancy there is a 25% chance of normal AA offspring, 50% chance of carrier AS offspring, 25% chance of affected SS offspring. All the children may be normal AA, carriers AS, affected SS, or mixed in various proportions.
There are about 4.4 million people in the world who have sickle cell anemia, while an additional 43 million are carriers. About 80% of people with sickle cell anemia live in Central Africa. It also occurs relatively frequently in parts of India, the Middle East, and among people of African origin living in other parts of the world.
It is estimated in sub-Saharan Africa that 50 to 90% of babies born with sickle cell disease die by 5 years of age. This young man, Caleb, who's now 11 years old, was otherwise a typical sickle cell patient will get from time to time some pain or fever. And then all of a sudden he develops this stroke, not because of anything different about him, except he has sickle cell disease.
We're always going in and out of hospital. I've lost everything in life. Even the woman who bore Caleb had to leave. Caleb's needs are numerous. He's not able to do anything. He cannot walk, he cannot feed, he cannot do anything for himself. I am his hand, I am his head, I am his legs, I am his everything.
Is there any cure for sickle cell anemia?
Bone marrow transplantation is currently the only known cure for sickle cell disease. It involves replacing the diseased stem cells from the bone marrow with normal one from eligible donor, usually a relative. The procedure is however complex and finding a suitable donor can be very difficult. Therefore treatment usually aimed to avoid crises, relieve symptoms, and prevent complications. These include use of prophylactic antibiotics and vaccination to prevent infection, pain medications to relieve pain, drugs to prevent or reduce sickling, periodic transfusion to treat anemia, early detection and treatment of complications.
It is not that the outlook of sickle cell anemia is completely bleak. It only means they need more care and attention. With proper care, people with sickle cell disease can lead full lives and enjoy most of the activities that other people do. Early diagnosis is very important. It is now being advocated that every child should be screened as early as possible after birth. Let your children know their genotype as early as possible and counsel them appropriately on the right partner they can choose so as to avoid giving birth to sickle cell disease offsprings. Visit us today, together with your family, at Dean Hospital Isanlu, for genotype test and counseling. Your health is our priority, because we love you.